We have the SEBAC agreement. It is a year and a half in the making of negotiations between the state and around 30 bargaining units. This deal encompasses correctional officers, prosecutors, janitors. It encompasses managers, it encompasses people in the healthcare fields. This is 42,000 livelihoods that we are contemplating right now. At the base, what we do at the beginning of these negotiations is we set a base of what we're trying to accomplish. Where we can find win-wins, we're trying to find win-wins. And in 2017, when we had the SEBAC deal that we struck, it is estimated that we've saved about $8 billion that the Comptroller's Office has noted over this time period. And our state workforce has been incredibly generous with the state to make sure that we have a balanced budget. For this year and this agreement, we have to go back about a year to make sure that the agreement that we have today pays for the raises that our state workforce would get retroactively, going back to July 1st of 2025 until June 30th of 2026. And part of this agreement goes to fiscal year 29, where we are going to have a wage reopener. The very basic of this is that our workforce is going to get a 2.5% raise every year. And there are a number of corrections with our various tables, bargaining units, that are specific to each of these categories. So for example, we know that our prosecutors can go to the private market, they can go to the Attorney General's office and make more money. And we need to be consistently making investments in our workforce, because if we don't invest in our people, then we're going to end up spending more money because the work isn't going to go away. So we have to hire new people, train them, they'll go somewhere else where the pay is better, and we end up spending more money than we need to. So with prosecutors or judicial marshals, or people that are going to pull away dead bodies in the middle of the night who are getting paid $18 an hour, we're giving some pay increases that are more than that 2.5%. We're changing what the steps are, because there's a recognition that some of these jobs have fallen behind of market standards so badly that we're having trouble hiring. So the very general premise that we agreed to at the very beginning of negotiation, with the recognition that there were a number of bargaining units that went to arbitration because they wanted 3.5%, but then through negotiation they came back down to 2.5%. We have healthcare efficiencies are a big part of this deal, simply meaning that we're going to be providing an incentive to our state workforce to not be taking health insurance. That is in the case that you have a spouse that has good health insurance. The idea being that if you don't want to be on our health insurance plan, well, we'll pay you to come off of it, because that's a massive savings to the state. That's a big part of this. That's a win-win. There are changes to Medicare Advantage and Medicare Wrap, allowing a little bit more flexibility to our workforce to buy the Medicare version that they're looking for. With HEP, we're ensuring that by giving money that is now tax deductible, we're ensuring that our workforce is healthy. And a healthier workforce means, again, less costs to the state. We have fertility service point solutions, the general idea being that when you're good to people and people are healthy, you're far less likely to have long and extended stays in the hospital, NICU stays. We're trying to get people to our workforce to use Yukon Health more so that we can provide health services at a more affordable cost. We made some minor changes to pension administration fixes, just back-end fixes, making sure that there's clarity in the system. We also are going to have a working group for telework. Telework was actually part of SEBAC in 2017, well before the pandemic. And we don't even need to be talking about this until next year, but there's an understanding that there may be need to correct some of how we're dealing with telework. And there are folk in labor who feel that this is a perk that we need to keep, and that we are not actually losing any level of efficiency, any level of productivity, and that to continue bringing people into the state workforce, we should continue having that flexibility with telework. There are other voices that believe that we are not getting the same level of effectiveness from our state workforce. So in January of next year, the working group will convene with its solution, its answer, how we want to continue moving forward. It's important to remember that this 2.5% increase is commensurate with what is given to municipalities. It's commensurate to what we ourselves have given in the past. It's often in line with inflation, so that 2.5% really doesn't count towards much more in terms of actual earning power. It's important to remember that we don't have a county-based system. And the reason it's important to remember that we don't have a county-based system is that when you're comparing us to other states, you need to take into account that we're the only state without counties, and some of these county jobs in other states are on the higher end. The state absorbs that cost. So we need to make sure that if we're comparing ourselves to other states, we're taking that into consideration. Again, this contract is going to be retroactive to July 1st of last year. There's another change for the retroactivity of direct retirees. So if you go directly into retirement in that retroactive period over the last year, you will get the benefit of this negotiated bargain. If you leave the state workforce and go to work somewhere else, you do not get that benefit. A direct concession from the unions. That's about the long and short of it. Over the course of fiscal year 26, the cost is estimated to be about $200 million. Fiscal year 27, it's $431 million. We have the RSA, that's the reserve fund that we put into place last year that covers these costs. Costs for fiscal year 28, fiscal year 29, that's for the legislature to figure out next year. We have 30 days from the time that the deal was struck to ensure that we come in to session to debate whether or not we're going to agree that this deal should move forward. If we say no today as a body, it goes back to negotiation. And then there's, I believe, an arbitration at that point. If it comes back to us again, and we say no again, it goes back to arbitration where they have then final say. So we do have say in this room as to whether or not we move forward on this contract. We do have that ability. It's about 1,100 pages worth of contract here. And every single bargaining unit did something a little bit different. But the premise is this. Our allies, our friends, our workforce, who protect our constituencies, who make sure that prosecutors ensure that people who are a danger to the public go behind bars, make sure that public facilities are clean, make sure that the trains run on time. These are our constituents, they serve our constituents. It is our duty, and I believe it's our obligation, to treat them fairly. And we have to have an eye, a managerial eye, recognizing that when you give less, you sometimes end up paying more. And when we leave vacancies and we have more overtime, that's when we pay more. And when we have people that we train over the course of years that go to work for other jobs, that's when we pay more. That's what making investments in our workforce over the long run ends up netting us a savings. And that's a big premise of the negotiations that we have in front of us today. The last point I'll make is this, is that when deals go to arbitration, They generally favor the workforce. For those in this room that have concerns about how much we're spending, I would suggest that this is a very good deal. It's a good deal for the state. It's a good deal for the workforce. I'm proud to be up here defending this budget and defending this agreement. Not budget, just agreement. And with that, I urge adoption.